Today we discuss how to examine the abdomen. Okay, continue.
Okay.
Abdomen examination. As we usually examine the whole system in the body by inspection, we start by inspection. First of all, we look to the shape of the abdomen. You see the abdomen? The shape is normal. We have three types of shapes in the abdomen examination. Distended, normal,
Scaffold.
and scaphoid. Distension of the abdomen divided into two: generalized distension or localized distension, left or right, up and down. The scaphoid abdomen is so flat and seen in emaciation, in severe weight loss, in malignancy. There are 10 points in inspection. First of all, the shape of the abdomen. The second symmetry,
Type of respiration.
the type of movement of the abdomen by respiration. You know, as we said in the respiratory system examination, in the male and in kids also, mainly the respiration is abdominal, while in female the respiration is what? Thoracic. Therefore, this patient got abdominal type of respiration, and also the abdomen is moved. No movement in the abdomen means that there is something in the abdomen. Most probably acute insult, just like peritonitis. 3.
Visible pulsation. Okay.
What the third in the examination of the abdomen by inspection? We said the shape. 2, we said the movement. 3, the umbilicus. This is the umbilicus. We have 3 types of umbilicus. Inverted, which is normal. Everted, which is abnormal. And sometimes seen in what?
Indicate increase intra-abdominal pressure.
Increase intra-abdominal pressure. And what else?
Obesity. Obesity.
بالobese or hernia or a flat abdomen اللي هي still normal. 4th, shape of the abdomen, movement, umbilicus, and what else?
Visible vessels.
Sorry?
Vessels. Visible vessels.
Vessels. The vessel in the skin of the abdomen, normally there are a few vessels in this area only. The pathological vessel in the abdomen that run from down below up to the chest, just like this, as a zigzag, is the most common abnormal vessel, and indicating there is inferior vena caval obstruction. And inferior vena caval obstruction causes are what? 3T.
Tumor.
Tumor.
Trauma.
And by tumor we consider
Benign and malignant.
benign and malignant,
Thrombus.
trauma and thrombosis. While cavit medusae in this around the umbilicus, till now I haven't seen anyone. It's very, 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 very rare. Cavit medusae. Therefore, shape of the abdomen, movement, umbilicus, and blood vessel, and what else?
Visible pulsation.
Visible pulsation. We ask the patient to hold his breath, and we look for pulsation in the abdomen. There is slight epigastric pulsation in this patient. An epigastric pulsation seen in hyperdynamic circulation, just like anemia, exercise, fever, anxious patient, thin patient, also masses over the aorta, abdominal aorta, transmitted to the skin. What else?
Any pigmentation around them?
Yes, pigmentation. Pigmentation in the abdomen, and normally the pigmentation of the abdomen, it happens in females, linea nigra, what they call this, and sometimes pigmentation you see all over this area in the abdomen. What else?
Any scar or?
Yes, scar. This patient got a scar, longitudinal scar, and it is an old scar because the scar here is white. What they call this scar?
Right paramedian.
Yes, this is the median, this is
Left.
left paramedian scar. This patient had trauma while he was kid on his tummy, on his abdomen, and the kidney being damaged, the left kidney being damaged and being kidney being removed at the age of 5, as he told. What else? Hair distribution. Normally the hair distribution in female till the umbilicus area, and in male probably all over the abdomen. What else? And stria. Stria in female, usually stria, it happens because of what? Of pregnancy. And sometimes stria, it happens where? In obesity. It is a damage to the inside the skin, elastic tissue. You get tear in that skin, therefore a dark skin above it will transmit that torsion, that breaking skin under skin in form of stria. And then inguinal region and the genitalia is the last two you have to inspect in the abdominal inspection. Okay, these all inspection of the abdomen. The second part of examination is palpation. You have to make your hands hot, not cold. In a cold weather, then you examine the abdomen by palpation. Examination of the abdomen by palpation, we have the light or superficial examination, and we look to the face of the patient for pain. This light palpation of the abdomen with a flat hand, it will localize the painful area in the abdomen first, and probably you will pick an enlarged organ in the abdomen by light palpation. The second is deep palpation, just like this. We start in the suprapubic region and we go anti-clockwise, this, and then we return to this area. The third part of palpation is a specific organ palpation. We palpate the liver, and we palpate the spleen, and we palpate the gallbladder, and we palpate the kidneys, and we palpate the suprapubic organs, especially in female, the bladder, the ovary, and the uterus. We start in palpating the liver. Palpation of the liver, there are two types of palpation of the liver. Either is a in single hand. This is, they call it rough palpation. We ask the patient to take a deep breath, and then we put our hand just like this, and we move our hand up and down with the inspiration of the patient to see if there is any palpable liver Yes, the liver is here palpable. This is a rough palpation of the liver. There is a specific palpation of the liver. It's by 2 hands, just like this. خد نفس وطي نفس. خد نفس وطي نفس حيل. خد نفس وطي نفس حيل. بعد حيل. حيل. Yes, this area. This is more accurate than the first one. And this is how to palpate the liver. The lower edge of the liver. The lower border of the liver. If you palpate the lower border of the liver, be sure, is it soft or hard? Is it smooth or not? Then the second type of palpation, specific palpation of the abdomen, is the palpation of the spleen. This area, the spleen in the left side, the liver in the right side. We started from the right iliac fossa toward the spleen, crossing the umbilicus, just like this. This is the way to palpate the spleen. Push your hand and then move it up with the inspiration. بعد حيل خد افتح الجبهة. خد نفس. I couldn't palpate the spleen. To be sure, we have to turn the patient to what? To the right side. دار عليه. دار عليه. خلي ايدك هاي، خلي ايدك فوق راسك هذه. دار بعد. هاي اثنين، هاي مثل، هاي مثل، وهاي اثنين. هاي اثنينها. Just like this. خد نفس وطي نفس. خد نفس وطي نفس. خد نفس. Yes, this is probably the spleen. We confirm this by percussion. Yes, dull. Okay? The spleen. The formula of the spleen is 1, 3, 5, 7, 9, 10, 11. The 1 is the thickness. 3 is the width of the spleen, and 5 is the length of the spleen, and 7 ounces is the weight of the spleen, and 9, 10, 11
Ribs.
belong to the ribs in the left side. It occupies usually the anterior part of that area. 9 ribs and 10 and 11. Once it crossed it passed the 11, it be enlarged. Once the spleen is palpated in the abdomen, it means twice to thrice its normal size. And the ounces is nearly 28 grams. Each ounce is 28 grams. The spleen and the liver. Palpation of the kidney. Kidney, this is the area of the kidney. This is the area of the kidney. Because it's the liver in the right side, the kidney in the right side is slightly moved down. And we couldn't palpate actually the kidney in normal, except probably the border, the upper border or lower border of the kidney. If you find it, you should do a palpation palpation of the kidney. One hand is flat and you push the other hand from down to up, or you push the hand above the abdomen to the hand below, and the other side is also. Palpation of the gallbladder. Actually, the gallbladder, if it is distended, is hardly been palpable. It's usually we look for the sign of tenderness when we pass our hand to the gallbladder. Once it's tender, it means that there is an inflammation in the area. Palpation of the bladder, we started from the suprapubic area until we reach the dome of the bladder in the midline, and then we press it. We get what? We get an urgency, I mean a desire for urinification in the patient in this area, and then we percuss it. If the bladder is dented, you get dull. The ovary is in on both sides, left and right. All these organs, the ovaries, the bladder, the uterus, all these organs, we cannot go below it. While the organ in the upper abdomen, upper part of the abdomen, the liver, the gallbladder, the spleen, we cannot go above it. How to differentiate this is a palpable kidney or spleen? The spleen usually is superficial, while the kidney is down below, deep. The spleen, when you percuss the spleen, you get it dull, while if you percuss the kidney, a large kidney, you get it what? Tympanic. And the spleen got aged, and the spleen got notch also. And a large spleen just below 2 or 3 fingers below the costal margin called mildly large spleen. Moderately large spleen is still the umbilicus. If the spleen crosses to the other side, we call it a huge spleen. If the patient got ascites, distended abdomen, everted umbilicus, and distended abdomen, and we think that this is a case of ascites, we usually percuss. You get tympanic. When you go to the side, you get it what? Dull. If you change the position of the patient, you get this area is coming to be tympanic, and the other area is coming to be dull. And then you should do a transmitted thread by your hand just like this. All these, how to examine the abdomen. The last thing in the examination of the abdomen, sometimes we examine the aorta in this way, above the umbilicus, to the left, by our hands. وننزل أصابعنا just down below, we push it down until we palpate the pulsation in the aorta, and we move our hand to the left and to the right and up and down. For what? For para-aortic what? This is how to examine the abdomen. This is ABC to examination of the abdomen. Any question?
بس بالنسبه للشيفتنج داونز، يعني احنا سوينا الطريقه هذه ولقينا هنا داونز، رجعنا الميلاد على another side وتحول من شيفتنج داونز الى ريزونانس. نكمل دور الامبلايكس او نكمل؟
هي اناف بالنسبه لك، بس تكمل تو كونفيرم مور انه الدلنس تحولت منا الى تحولت منا.
يعني بس ما يقبلون نرجع يعني.
على كل انت تكونفيرم. شو المسألة رياضية وتطلع ناتج وبعدين تعيد تشوف الناتج صحيح ولا لا.
بالنسبة للسبلين يعني normally there is dullness يعني upper 9th 10th 11 normally يعني
dull over this area.
Yes.
It is only 5 centimeter length. You hardly you can't get a dull area in the normal.
Yes.
The spleen, if it's still large, it means size become 3 more size. Therefore, it's become dull. Percussion of the spleen for the enlarged spleen usually. Any question?
So a third maneuver to the palpation of the spleen, the catching of the lower costal margin of the left side is acceptable?
To me? I don't know. Anyway, if you suspected there is a large liver in this area, but you are not sure that the liver is enlarged, then stethoscope. We call this test is scratch test. We put our stethoscope in the ear, and this is, we palpate this area, and we are not sure whether it is liver or not. We put the stethoscope just like this, and we push it, and then we scratch the skin. If we hear more scratch in this area, we put a dot there, here. Therefore, we join this line together, you get an enlarged organ there. This test is called scratch test. To confirm that there is a solid organ is just underneath your stethoscope. This is another test called scratch test.
And sound increased.
Increase. You mean you are scratching away from the stethoscope is not being heard. Once you reach an organ, a solid organ near the stethoscope, 5 centimeters from the stethoscope, even more than this, you will get it increased. It means there is a transmission, more transmission of the sound from your hand scratching to your stethoscope because of the solid organ below. To complete the examination of the abdomen, the last thing is auscultation of the abdomen. Auscultation of the abdomen, we use the diaphragm. This diaphragm, we put it in this area for the bowel sound. Okay, and because of the aorta is ending near the umbilicus and the renal artery is above it, and auscultation for renal artery stenosis in this area, we hear a systolic, and in this area we look for a systolic bruit in this area in the renal artery. For renal artery stenosis, and the commonest cause of renal artery stenosis is traumatic. As we said, the hypertension in adult, 90% of the causes is essential, and 10% of hypertension in adult is what? Secondary. Of these 10%, 9 cases of 10 is renal causes. And one of the renal causes is renal artery stenosis. Causing what? Hypertension. And usually renal cause of hypertension, the hypertension is severe one. Not a mild or moderate or benign hypertension. Fadal. That's all about the examination of the abdomen. Any question?